Hey everyone, here to talk about a past pandemic to put it in comparison to today's pandemic, the COVID-19 virus, which is just one of many thousands of strains of the coronavirus. The coronavirus is it's a family of viruses, and I talked to a doctor yesterday, and she said that there's thousands of coronaviruses. This is just one. So the reason I'm going to talk about a past pandemic is because I think social media has changed the game and is creating a lot more panic, pandemonium, paranoia, and hysteria than is needed. Because this pandemic I'll talk about happened in 2009 into 2010, and there was none of this panic back then, and the numbers were much higher then. But that's because, I think, partly because social media was just getting started there. You know, Facebook was just getting warmed up. Same with some of these others. People weren't hooked on them yet, and so I think part of the chaos today is just being built up through social media. It's making people crazy. So here's some statistics from what was known as the swine flu that started in March of 2009. It started in March of 2009. It was it spread, well, first let me just tell you. So it affected its first human in Mexico in March 2009, and then it spread to California in April, the next month, and then in June, 2 months later, in 2009, the World Health Organization declared it a pandemic. And at the time, it was in 74 countries at that point. Now, first I want to mention, I read from a reliable source, not Facebook or some other gossip columnist. I read from a medical journal that's been around since 1823, and it's very well respected. It's called the Lancet, Lancet. It's a London-based medical journal. It was founded by Thomas Wackley, and it's, like I say, it's been around for 2 centuries, and it's sought to address urgent topics in our society. Now, they said the death toll from the swine flu epidemic in 2009 killed as many as 575,400 people. The swine flu was caused by the H1N1 influenza virus. So now this study was co-authored by 9 members of the Centers for Disease Control Influenza Division. They estimated that there were 201,200 respiratory deaths and 80,300 cardiovascular deaths related to the H1N1 influenza virus, otherwise known as swine flu. In the introduction of their study, they said the influenza pandemics are typically characterized by higher but widely varying numbers of deaths than is a seasonal epidemic. Now here are the numbers from the H1N1 influenza virus, otherwise known as swine flu. These numbers are the total of respiratory and cardiovascular deaths due to this virus. Now in Africa, now they give a range of possible deaths, and then they kind of pinpoint it at the closest best estimate. In Africa, the range was a possible 34,600 up to 125,900 deaths, and they put the estimate at 65,600 deaths in Africa. In the Americas, that's North, Central, and South America, they said there was a possible 16,200 up to 61,500 deaths, and so their estimate is 29,700 total deaths in the Americas. In the eastern Mediterranean, they said there was a possible 12,300 to 47,100 deaths, and they put their estimate at 23,600 deaths. In Europe, they said there was a range of 17,200 up to 67,600 deaths, and they put their estimate at 31,300 deaths. Southeast Asia, they said there is a possible 40,900 up to 158,900 deaths, and they put their estimate at 78,600. And then the Western Pacific, they said there was anywhere from 30,600 to 114,500 deaths, and with their estimate at 55,700. So the estimated global death toll from the H1N1 influenza virus was 284,400. However, the range of possible deaths was 151,700 up to as much as 575,400 deaths. 65% of the deaths were in the 18 to 64 year age group. Which is kind of the opposite of this virus. 20% of both respiratory and cardiovascular deaths due to the swine flu H1N1 virus, 20% of the deaths were above 64 years of age or older. That means 80% of the deaths were below the age of 64, which again is different from this COVID virus, because in Italy, the deaths were between like the ages of 82 and 87, and in China, all the deaths, from what I read, were above the age of 70. The mortality rate in Africa from the swine flu was 2 to 3 times higher than elsewhere because of their lack of ability to fight it like other countries. In the first year of the H1N1 swine flu, where it was circulating in each country, an estimated 105,700 up to 395,600 people died of associated respiratory illness. And then the cardiovascular took this figure up to that 575,400 potential death figure that I already read. The World Health Organization said 11%. Now notice, I said World Health Organization. I didn't get this from Facebook or Twitter. World Health Organization said that 11% to 21% of the global population, which in 2009 the global population was 6.8 billion. And the World Health Organization said that 11 to 21% of that population got infected with the swine flu. That's 700 million to 1.4 billion people. But you know, somewhere between 151,000 and 575,000 died from it. Transmission is kind of like the current virus. It's done through coughing and sneezing and touching surfaces that have been contaminated by someone that's coughing or sneezing. The infection control. Now, on May 7th, 2009, the World Health Organization stated that containment was not feasible and countries should focus on mitigating the effect of the virus. They did not recommend closing borders or restricting travel. Which, that's interesting, because now it's totally different. Again, this is the World Health Organization. They said the typical seasonal flu statistics, according to their research, and this is based on today's population of 7.75 billion. They say that 5 to 20% of the population gets the regular influenza flu each year. That's 340 million to 1.6 billion people, and that results in 290,000 up to 650,000 deaths each year. That's from the regular flu. Anywhere from 290,000 to 650,000 deaths each year. Now again, I'm not comparing the regular flu influenza to the COVID-19 coronavirus, but I just found that interesting. And then on, I believe it was on August let's see, it was on August 10th, 2010, the World Health Organization declared the pandemic of the swine flu was over. So their declaration of the swine flu went from June of 2009 to mid-August of 2010, so it lasted 14 months. So another interesting thing to know, especially here in the United States, as you see the positive cases go up, it's no reason to panic, because you have to look at the numbers. Up to a couple of days ago, only about 5,000 total people in the United States had been tested for the COVID-19 coronavirus. That's out of 320 million people. That means there could be no more than 5,000 positive tests, because that's all the tests that were conducted. As of 3 days ago, the state of Colorado had the potential to test up to 80 people a day for the entire state. And Texas, the big state of Texas at the time, had the capacity to test up to 30 people a day. Now they did announce in this state that they now have like 900 to 1,200 testing kits sitting there, but their capacity to test hasn't gone up, although they did open up a drive-through testing site at Lowry Air Force Base, where somewhere out there in Lowry there's a drive-through where you can go up with a doctor's note that says you need to be tested, and they'll test you. So the testing capacity is going up now. But the point is, the officials in Washington State have said that the virus has probably been up there since early January or late December. We just didn't know it because they weren't testing specifically for it, and you can only know if someone has it if you give them the specific test. So the numbers are going to go up. Let's say we test 1 million people, maybe 50,000 turn up positive. That doesn't mean all of a sudden 50,000 more people got it all of a sudden. That just means that we discovered that they have it, and they've probably had it for a while and it's been floating around. So this virus, it's already spread everywhere. It's already everywhere. So don't panic. Don't panic. That's, just do like they say. Practice sanitary habits. Wash your hands. Cover your mouth when you sneeze or cough. And the interesting thing will be to see is if the incidence of the regular flu influenza will go down, if those numbers go down, because people are being more sanitary now, like they should have always been in the beginning. So anyways, that's my thing on this. But again, I think social media is causing more panic than needs to be. And don't go off what you read on the Facebook news feed. Go to an actual site like Lancet, Lancet, the medical journal from London, or go to the Centers for Disease Control, or go to the Harvard Medical Journal. Read from those well-regarded sites. Read real statistics, real reliable information. Thank you.